Good afternoon, everybody. My name is Elizabeth Johnson, and I'm the pharmacy manager at the LECOM Senior Living Center Pharmacy. And I'm here to talk to you about medication compliance and the importance of communication with your pharmacist. So a couple important things to think about when you're talking about pharmacy is to consistently use the same pharmacy. When you try to do pharmacy shopping for the least expensive medication, you end up running into issues that the interactions can't be evaluated by your pharmacist. So it's really best to use a single pharmacy so that we have access to all of your current medications. We can keep records of all of your vaccines, and we would really like to establish a very good relationship with our patients. In retail pharmacy settings, it also can get you enrolled in automatic refills so that you don't have to call in your refills to the pharmacy, that they just get sent automatically. So medication compliance is also very important. When your physician says that you need to take a medication, it's very crucial for you to take it every day. There are some things that can help you remember to take medications, such as alarms on your phone or an alarm clock, pill boxes, a medication log, having your pharmacy do automatic refills. And if you have any concerns about any of your medications, such as forgetting to take them or having to take too many, please reach out to your pharmacist, because we might be able to suggest a combination product that would take you from 3 pills down to 1. A medication list is very important to keep on you at all times, and make sure that your pharmacist has a list of all of your current medications, including over-the-counters. Your physician has a copy of this list, and then it's something that you can take with you that, God forbid, you end up in the hospital, so they have a current list of your medications. Many over-the-counter medications or herbals and supplements do have interactions with prescription medications. So making sure that you tell your physician or your pharmacist what over-the-counter or herbals that you take can ensure that all of your medications are being dosed properly and there's nothing that would be dangerous to you to take. In the instance that you miss a medication or you accidentally double up on a medication, you can always call your pharmacist to ask what you should do. Sometimes if you miss a dose, there's not really a concern. You can just take it the next day or when you remember. But there are some instances that if you miss a dose or double up on a dose, you need to seek medical attention. So keep that in mind, that pharmacies are often open when a lot of physicians' offices are not. So you can always call a pharmacy when your doctor's office may be closed, and we have access to resources that will be able to tell you what the appropriate solution to that would be. It is not okay to share prescriptions. If you take away anything, if something is prescribed to you, do not share this with someone else. When a physician prescribes a medication to you, they've already evaluated you. They've looked at your med list. They know your history. So if your husband, wife, daughter, son have a similar ailment, they've not been evaluated. That medication may be very dangerous to them based on other medications. So I understand that going to the hospital or going to the doctor can sometimes be a little bit overwhelming, but please do not share prescription medications, as this can be dangerous and it's illegal, if nothing else. As I was saying before, over-the-counter medications, they are safe to take. I don't want you to not take over-the-counter medications, but they can interact with prescription medications. One of the biggest ones that I can think of that many people know about is St. John's wort. A lot of people are told to take St. John's wort, but it interacts with just about every prescription medication that you can be on. And this can mean you would get more of the medication, the prescription medication, or it could mean you don't get enough of the prescription medication. So it could be dangerous either way. It could cause you to get less of a cardiac medication that's not going to do you any good for your blood pressure. So just be cautious of your over-the-counter medications and make sure that any over-the-counters are listed on your medication list. So pharmacists have a very intimate relationship with physicians. We talk to them regularly. We call them with concerns. We also have your medication history. And we will call them and say, you know, they're on this medication. It's not safe to take with that medication. There are a lot of people that get very impatient when they go to a pharmacy because, oh, geez, why does it take so long to count 30 tablets and put them in a bottle? But there is much more to what we do as a pharmacy to make sure that your medications are safe for you to take and they're dosed appropriately. Because errors happen. No one is perfect. We are not perfect. But we try to ensure the most effective medication for you and that everything is safe for you to take. And as I was saying before, this can also help decrease your, what we call your pill burden. If there is a combination product, we can call your physician and say, hey, they're on these two medications that come as a single tablet. Can we take them so they only have to remember to take one tablet a day instead of two? So we will do that from time to time if we can. It could ultimately not only decrease the number of pills, but also save you money because you're only paying for one prescription instead of two. However, pharmacists are not just for medications. We are also, many pharmacists are licensed to immunize. So we can provide basic immunizations, the flu vaccine, the COVID vaccine, pneumonia, the newest RSV vaccine. We can and do provide those to the community and to our patients. These are also very important. We have access to a system that will track all of these vaccines. So we can also suggest to our patients what the most current recommendations are and what they would be due for. If they're eligible for the newest RSV vaccine, if they're eligible for the newest COVID booster, that's all in a system that we have access to. So we can say, you know, you need a COVID booster. You need this most current COVID vaccine, or you need a new pneumonia vaccine. So we can really keep you up to date, and our system will actually prompt us to say, you know, Mary Jo hasn't had her COVID booster. Maybe the next time she comes in to pick up her medication, it's suggested to her because we have them in the pharmacy and we can give them right on the spot. However, you should not depend on your pharmacy for everything. It is very important to follow up with your doctor because, yes, we can monitor your medication, but your physician can order lab work and make sure that everything that isn't evident on the outside is being managed and properly addressed. So make sure you follow up with your physician. Get your routine blood work. Get any routine tests, bone scans, eye tests, foot exams, because those can be very crucial to not only your comfort, but also your well-being. Medication storage and disposal can be a very large danger. So make sure that all medications are kept out of the reach of small children or grandchildren or great-grandchildren potentially. Keep them stored away from small hands, because even though they claim to be child-proof, I guarantee at least 25% of children can open those bottles. My children would be part of that 25%. So always keep them out of the reach of children. Also, where you store a medication is very important. A lot of people put them in their bathroom, in their medicine cabinet, because that's where the medicine cabinet is. However, that is not actually the appropriate place to store medication. It should be stored in a cool, dry, room temperature environment. Your medication cabinet in your bathroom with your steamy shower can affect the integrity of your medications. So it should be kept away from steam, away from heat, and that would be what is in the bathroom. Medication disposal, historically, flush unused medications. Well, now they've found out that that gets into our water sources and can be dangerous to whoever's drinking the water. So some of the suggestions that we have is to use used coffee grounds or kitty litter to make them unappetizing to someone who could be in the trash. Put them in there, put a little bit of water in there. It will start to break down the medications. There are also programs through the Department of Health that are called medication take-back days. So if you have a medication you no longer take, there are boxes at many fire halls, many police stations, and some local schools and other local companies will do medication take-back days so that they can properly dispose of them, incinerate them, make sure they stay off of the streets and out of the water supply. So the PA Department of Drug and Alcohol Programs is who actually is in charge of the medication take-back days. These are some of the examples of local places that have just boxes. You don't have to talk to anybody. You don't have to see anybody. So you don't have to be embarrassed about what you're throwing away. It's kind of like a clothing deposit box for donating clothes, except it's for unused medications. So the Northeast Police Department, you can walk in, drop them in the box, and walk out. On the state police barracks on Iroquois Avenue, many of the CVS's, I started listing them and stopped when I got to about 10 and just encompassed it with CVS. The Erie County Courthouse has a box because everyone really wants to make the effort to keep these medications off the street because it can be dangerous if a child or a homeless person would come in contact with that. We are here to help. We really want to make sure that you understand your medication, that you understand why you're being treated with the medication that you're being treated with, what it's for, what you can do, what other things other than medications you can do to help your condition. So please reach out to us if you have questions or concerns. We're more than willing to have a conversation with you to make sure that you understand and will take your medications because we really want you to have the most comfortable and the healthiest life that you can. All right, well, thank you for coming. Enjoy some cookies and refreshments. And have a wonderful day.